everyone, I am Dr. Subhajit, the visiting consultant in Bhagirathi Neotia Women and Child Care Hospital, Newtown. Today I like to focus our discussion to certain diseases which mostly affect the children and women, especially the working women, the young and adolescent girls and the female at the childbearing age. In the current century, when the life is extremely hectic and stressful and full of competition, every day huge number of patients come in OPD with a severe headache. Sometimes it is associated with vomiting, nausea and some visual problems. Some of them complain some throbbing and pulsatile sensation in one side, especially associated with the redness of the eye. Some of them take some over-the-counter medication and analgesics which may further worsen the scenario. According to the International Headache Society, there are various types of headache, starting from the chronic migraine to chronic tension type headache, from the cluster headache to chronic persistent daily headaches. These are mostly presented with various clinical manifestation and complications. They are mostly associated with the fatigue, stress and some traumatic life event. These may sometimes occur due to some hormonal changes. They may occur in the perimenopausal period, may occur following the intake of any contraceptive pills. There is a common dietary triggers of migraine like caffeine overuse, the caffeine withdrawal, the chocolates, excess of alcohol consumption and the monosodium glutamate, which are mostly used as a taste enhancer in the street side Chinese foods. So this is basically a neurovascular disease, and this is diagnosed mainly by the thorough clinical examination, and neuroimaging study is sometimes necessary to rule out any intracranial lesion or any vascular lesions in the brain. The cigarette smoking is another important risk factor for the migrainous headache. There are mainly two types of treatment of migraine. One is the acute phase medication, another is prophylactic medication. The acute phase medications are mainly used to reverse the progression of headache, like triptans, opiates, analgesics, NSAIDs, etc. And the prophylactic medications are indicated when these acute phase medications are overused or being ineffective. And these are also used when there is an increased duration and frequency of the acute phase medication. The duration and the frequency of the headache increases. In the current advancement of medical sciences, there are several non-invasive neurostimulation techniques which may prove to be effective, like transcranial magnetic stimulation, transcranial electric stimulation, which is helpful to reduce the headache. The lifestyle modification and dietary changes is often play the most important role to reduce the headache. In the advancement of current medical scenario, there are several important drugs and now coming in the research, like CGRP inhibitors and others. This will definitely help to reduce the clinical burden of this migrainous headache. So thank you.